What's up, beautiful people? Another day, another study. We've talked before on the channel about how higher intake of ultra-processed food is associated with adverse health outcomes, including depression. Well, this was a cohort study and an updated meta-analysis of studies looking at ultra-processed food intake and depressive outcomes. And in the cohort study, they found that those who had the highest intake of ultra-processed food intake versus the lowest had a 24% increased risk of depressive outcomes, and this was after they adjusted for a whole host of confounding factors. And they found for every 10% increase in ultra-processed food intake, there was a 7% increased risk of depressive symptoms. And in the meta-analysis, they found a 32% increased risk of depressive symptoms, and these numbers are in line with previous studies in this area. And the mechanisms aren't entirely sure. It could be due to poor nutrient quality in diets high in ultra-processed foods. It could be due to inflammation. Higher intake of ultra-processed foods is associated with increase in inflammatory markers, including C-reactive protein. It could be related to effects on the gut microbiome. So more is needed in that area to find the causative mechanisms. But as far as what we can do, we can reduce our intake of ultra-processed foods and have a diet that's mostly whole foods.